All right. Welcome to the Jefferson County Public Hospital District Number 2 Board of Commissioners meeting on Wednesday, April 23rd, 2025. This session is being officially audio recorded and time shown on the agenda are estimates only. We will have an executive session under RCW 4230-110G to discuss the performance of a public employee. Is there a motion to approve the agenda as it stands?
So moved.
Is there a second?
Second.
Discussion? All in favor, say aye.
Aye.
I have a comment.
Aye. Excuse me, we're in the middle of the motion. Aye, okay. Opposed?
Opposed. I had a comment.
Okay, go ahead with your comment.
I really think it's urgent that we have something on the agenda related to regional alliances that the public knows about and I'm sure wants to understand what's going on.
Do you want to make a motion?
Sure, I'd like to make a motion that we have regional alliances.
Okay, is there a second to that motion? Okay, there's no second. So we will continue with the main motion of accepting the agenda as presented. All in favor, say aye again.
Aye.
Aye. Those opposed?
Opposed.
Okay, and no abstain. Pardon me? Did someone? I heard something.
Oh, I think
Okay.
you're good. I think you're good to go.
All right, then it will stand approved as shown. So up first, we have Dr. Molly Parker, our Chief Medical Officer, and with an update on the very, very, very important Jefferson County Early Learning Center. Dr. Parker, thank you for being with us, and how we're anxious to hear how that's all going.
Great. Well, thanks so much for having me. Shannon's getting the slides.
And then we will move on to Tina Toner, our
Jill, I have a point of information I just forgot to share at the beginning of the meeting.
pardon me?
I have a point of order, I guess, I forgot to share at the beginning of the meeting.
Point of order?
Yeah, I just need to share
yes.
that I am live streaming the audio of this meeting. I forgot to mention that. I'm attempting to. I don't know if it's working, but I'm attempting to live stream the audio. Just wanted you to know that.
All right. Okay. Next is our patient story brought to us by Tina Toner, our Chief Nursing. Time we will go into public comment period, and we invite the public to make any comments that they wish for regarding their hospital district. So, Shannon, do we have any emails or anything from the public that you know of?
No emails or physical mail.
Okay. All right, then in-person speakers. We welcome your comments. There is a 3-minute limit, and Shannon will give you a 1-minute warning before your time is up. It is the board's policy to listen to your comments without responding during this meeting. So anyone who would like to, and I see one hand raised, 2 hand. Okay, I'm going to go with Angela first. Angela, you have 3 minutes. Welcome.
Thank you, Jill.
Welcome.
Thank you. I've been chatting with my counterparts in Clallam about the OMC Jefferson Healthcare discussions, and it's interesting to hear their perspectives. Their concern centers around making sure that the fiscally unsound OMC is not bought by a Catholic hospital chain and thus losing access to healthcare that is important to the community. My Clallam counterparts noted Jefferson Healthcare's good fiscal record, good relations with the community, and great reputation for patient care. As I listened to them talk, I realized that this proposed linking might be great for Clallam, but really, from a public perspective, I'd like to know what's in it for Jefferson. Mike Glenn has kept the hospital fiscally sound through some very difficult times. We are facing more difficult times coming up. Would his attention be divided trying to get OMC up to speed, both fiscally and with patient care? My elderly mother-in-law has been treated at OMC, and it has not been up to the standard at Jefferson. And I can see it taking a lot of time and energy. Would Jefferson's quality and finances suffer? Likewise, the proposed board would have 5 members from Jefferson and 7 from Clallam. What would keep in the future Jefferson from being an afterthought? I'm talking about 5, 10, 15 years down the road. Given that Jefferson would be taking on the hard work of resolving OMC's issues, why shouldn't Jefferson have the 7 seats and Clallam have the 5 seats? I'm really concerned about this org chart. I know it's probably based on community size, but in terms of who's going to be doing the intellectual heavy lifting and who's going to be doing the work to get things going, I would think a much more fair distribution of seats would be in order before folks in this community would consider this a reasonable option. Thanks.
Hey, thank you for your comments, and anything like that would be certainly taken into consideration if that were the case. So thank you. Okay, I see another hand raised. IT unverified. T is, I'm not sure who that is. Can you identify yourself?
Yeah, actually, I simply entered my initials. This is Tom Tier speaking.
Hi, Tom.
Hi. Sorry for any confusion. Excellent, really positive reports earlier in the session, especially from Dr. Parker. However, there's always a but. However, the one part of what I heard that troubles me and has been troubling me for a long time, and that's the fact that the Jefferson continues to associate itself with the YMCA. The YMCA stands for Young Men's Christian Association. And the official mission statement from that organization is to, quote, put Christian principles into practice through programs that build yada, yada, yada. Affiliating with any organization that is religiously based is a violation of my First Amendment right of freedom from religion. And so many organizations, apparently including Jefferson, disregard that. They simply slough it aside because it seems like that's the only way that you can get money for certain projects. I don't consider that to be a legitimate excuse. Sorry. You are creating an environment which is inhospitable to people who are a-religious or otherwise religious by emphasizing the Christian aspect of things. And whenever you enter into these things, I really think you need to keep that in mind because you're really not doing the community as a whole any favors. You pay great attention to DEI, diversity. Well, apparently not so much, not in this respect. So I will just, I know that you're not going to do anything about it. I know it's not going to make any difference, but I still want it known that what you're doing is really not an appropriate use of taxpayer dollars in any respect. So thanks for the opportunity.
Thank you, Tom. I thank you for your comments. So certainly your comments are welcome. Anybody else have any comments to make? I can't see. Can you see the screen? Shannon, can you tell me if anybody else has got their hand up?
No more hands are up, Jill.
Okay. All right. If no one else has, first, we have minutes from the March 26th commission meeting. Is there a motion to approve those minutes?
So move.
Second.
Okay. It's been moved and seconded. Discussion?
I have a motion to amend the minutes.
Okay. And you make your motion. You may make your motion. Excuse me.
So I'd like to motion that it note during the agenda approval, discussion. All commissioners were told they could have a minute to speak, and Commissioner Reddy was cut off after 15 seconds and not allowed to speak his minute.
Is there a second to approve that amendment? Is there a second to approve Matt's amendment? Hearing no second, the motion dies for lack of a second.
I have another motion to amend.
All right.
During public comment, Commissioner Reddy was given 3 minutes to speak, and he was cut off after, again, like 20 seconds and not allowed to speak his 3 minutes in public comment.
Is there a second to approve that amendment to the minutes? Is there a second? There's no second. Dies for lack of a second. Back to the main motion.
I have another amendment motion. During the administrative report, Commissioner Reddy was muted while he was attempting to ask a question of the CEO and not allowed to finish his comment.
Is there a second to that amendment? Is there a second? Hearing no second, amendment dies for lack of a second.
Call for the question.
I have just one more final amendment motion.
The question has been called.
The question has been called. Is there a second to the question?
How can you call it? We haven't even had comments on the main motion.
Excuse me, but a commissioner has called for the vote and to end the discussion. That requires a second from the board. Is there a commissioner that will second that call to end the discussion? Okay, there's no second to that.
I have another motion to amend the minutes.
Right. Which is?
Commissioner Reddy made a motion to form an ethics and legal advisory subcommittee. During the discussion of that, Commissioner Kulf made a requirement that Commissioner Reddy stop posting to YouTube as a condition of his voting for the motion. The rest of the board allowed this demand to stand, and Commissioner Reddy had to respond to it. Anyways, that's my motion.
Is there a second to that amendment? Is there a second? Dies for lack of a second. We will go now to the main motion and approve the minutes as they stand. Is there everyone in favor? Say aye.
Aye.
Aye. Any opposed?
Opposed.
Okay, and that the motion carries to approve the minutes as written. So now we will go on to the medical staff credentials and